Good afternoon, and thank you for joining and participating in my webinar tonight on MedlinePlus. The primary purpose of this webinar is to demonstrate the free online health information database called MedlinePlus. My name is Veronica Blanken, and I'm the Consumer Health Librarian at Greenwich Hospital. If you don't know what that is, my job is basically to help people find reliable and accurate health information, whether it be online or print version, because health information is one of the very many types of information since the internet has been around that has been susceptible to a lot of myth and scam and misinformation. So I am here to help take people and patrons and the Greenwich community and beyond through all of the overwhelming amount of data, particularly when it comes to their health, and to help them make better healthcare decisions as a result. MedlinePlus is one of the databases that I recommend when first people come into my office and ask about a certain diagnosis, a type of medication. I am not clinically trained, so I do not know anything right off the bat. So I take them through MedlinePlus as opposed, and I kind of mention it as a way to branch away from where people might traditionally look for health information. So let's get started by just telling you that I always have a disclaimer in all of my presentations that this presentation is for educational and informational purposes only. Please always consult your doctor or healthcare provider for medical advice before making any lifestyle decisions that may impact your health. And that MedlinePlus is a database that is provided for free by the National Institute of Health Department, and therefore I'm not being sponsored I'm not being paid to promote this database. So the objective for today's webinar is to understand what MedlinePlus is and why it's the better option for health information as opposed to certain sites such as Google or WebMD, and to demonstrate some of the most helpful features of MedlinePlus. And I will be doing that by going back and forth, screen sharing the PowerPoint and MedlinePlus. And also, if you have any questions throughout the presentation, please save them for the end. By the ending slide, I'll have a slide that says, "Thank you for attending. Any questions?" And there's a feature on your Zoom taskbar that says Q&A. That's where you'll write your questions. So I just want you to think about the following question that's on the screen right now. Where do you normally go for your health information? For instance, if you see a weird mark on your skin, or if you start feeling not quite right, or you just read about or heard about a new type of disease, or if you want, for instance, something relevant, you want to know more information about COVID-19, what's the first place you go to look up more information about a specific health topic? When researching this, I found that these were the most frequent sources of information. A lot of people, especially in this community, have been able to get in touch pretty easily with their healthcare providers. In some areas that may not be the case, unfortunately, because especially now, most healthcare providers are on teletime, but they are swamped with a lot more work as a result. So getting in touch with them may be actually harder than it used to. The other source may be family member, friends who have experienced the same thing that you're going through or have heard about. I, for instance, have taken quite a lot of advantage from having two parents. Both parents are physician assistants. So while I was never able to fake sick in school, I was able to inquire with them first about anything that was bothering me health-wise. So it was very useful for me. And then the other most frequent was, of course, Google, or just searching the internet, browsing the internet willy-nilly for any information. So, and I'm hoping by the end of today's presentation, I can convince you to add MedlinePlus to your search source. So I have a chart here. One side describes a very well-known internet search database, and then the other one describes MedlinePlus. And I want you to look at this chart and see which one you think it applies to. So one on the left side, it says that this database engine or search engine provides millions and billions of results. It contains sponsored ads that may be biased, and the links that they provide may be biased. And it also does not, it's gotten better at it, but it did not initially vet a lot of the posts that were put on. For instance, it can feature not just research or peer-reviewed sources of information. It could also post like forums and such, just by any everyday people. And on the right-hand side, we have a search engine and database that gives you the information that you specifically need. And what I mean by that is that it has a very good ability to narrow down exactly to what you're looking for. It features no ads because it is a property of the National Library of Medicine, and that every single part of it is researched and fact-checked. So if you haven't guessed, by now the left-hand side is Google. Yeah, so in comparison to, and the right-hand side is MedlinePlus, what we're going to be talking about today. So as you can see, the left would be what describes Google, and the right would be what describes MedlinePlus. And I think you can tell just by that there are a lot more pros to using MedlinePlus than there are to Google. And just to give you more of a visual, here I took a screenshot of what would happen when you put in high blood pressure in a Google search. Yes, there's a very handy chart, there's a very handy visual there. It talks about it's very common amongst more than 3 million US cases per year. And but look at the number of links of results that you get. The huge amount of results that you get in 0.75 seconds, that's pretty impressive, but still a little bit overwhelming. And then I took a screenshot of what a search for the same topic, high blood pressure, would be in MedlinePlus database. And it looks like this. So it's, I think in terms of visibility and how it looks generally, it's very nice. A lot of white space so that it's easier to read. And it tells you exactly what to look for, from the basics to the research about it, to how to live with it, more resources to find an expert on it, and it even divides information about it by demographic and age. So that's what I meant earlier when I said that it narrows it down to exactly what you need. So you don't have to look through millions and billions of results. So there are a few features of MedlinePlus that I'd like to show you. The first one being health topics. MedlinePlus as a database includes over 1,000 diseases, illnesses, and health conditions. It covers their symptoms, causes, treatment, and prevention. I like to say that I like to call MedlinePlus a gateway database because when I show you the actual site, it'll feature the subject of the specific subject of the illness, as well as a link to an organization that specializes in that illness and the information about it. They'll make more sense when I show you. And then last but not least, the health topics can narrow down by body location, diagnosis, therapy, demographic groups, and health wellness. So that's what the page looks like when you actually click on health topics. But let me just get out of this PowerPoint and I can just show you right here and now. So this is the home page for MedlinePlus. If you Google MedlinePlus, that link will what it'll take you to, but you can also just go to MedlinePlus.gov. It'll take you to the same homepage. So like I said, the first feature is health topics. Health topics is right here. It's the apple in the green space. We'll click on it. And this is what that picture screenshot that I showed you in the PowerPoint looks like. So you can either find topics by putting it in the search here, or you can look it up by going through the A through Z, or you can go by it based on body location, disorder condition, diagnosis therapy, like I talked about. So if we want to, let's stick to the same example, high blood pressure. So if we're doing it based on the body location system, we want to go to blood, heart, and circulation. It'll take us to this little map right here of the human body. Because high blood pressure is associated with the arteries, we'd go here. You'd go all the way down to high blood pressure over here. And it'll take you to that exact same page that I showed you earlier for high blood pressure. So it's a lot of detail, but the way that it's formatted and structured on here is just very easy to read, very what we call consumer friendly, as opposed to, you know, a typical healthcare professional website would be a lot more medical jargon and a little bit more difficult to understand. A lot of people get confused about what exactly a normal blood pressure or high blood pressure means. So it does talk about systolic and diastolic, the numbers, what exactly they are. And then right here, they go to the National Institute of Health links. So you click on Blood Pressure Matters, Keeping Hypertension in Check. You click on the link, and it takes you directly to the National Institute of Health page that talks about blood pressure. So that's what I mean by it being a gateway database, that it provides a lot of great links. And they talk about the diagnosis and tests. A lot of these organizations are pretty interchangeable. And since MedlinePlus Database is a subsection of the National Institute of Health, a lot of these links will go to the National Institute of Health website. So, but there are different ones that they talk about, like when they talk about related issues, for instance, they will go to organizations that deal with those related issues. For instance, with COVID-19, when it comes to seniors with cardiovascular disease, it'll go to the Center for Disease Control and Prevention. Or it'll go to the American Heart Association because stroke is a big factor, health risk of high blood pressure. As you go down and scroll down, it just becomes very clear that they, like I said, they narrow down to exactly what people are looking for. And I just want to turn your attention to one last thing. There are a lot of people who come to the library want to have an easy to read patient handout to give to their family or friend. And I also get a lot of medical professionals who come here trying to look for easy to read, consumer friendly handouts for their patients. So this is where you'd go and you'd be able to print this page out, for instance, about blood pressure. So that's basically how a typical MedlinePlus page would look when you look up a health topic. So let me just go back to the PowerPoint. And also, if you want to go to the home screen, you just press the MedlinePlus logo and you go immediately back to the home screen. So that's helpful. So we're just going to continue here to the other great feature of MedlinePlus, which is the drugs and supplement page, where you can learn a lot of people get confused about medication. Sometimes they can't tell them apart. They don't know exactly what it'll do, specific side effects. So this page is great for just looking up the information for a specific drug, over-the-counter medication. It also includes information links on dietary supplements, herbal remedies, and complementary medicine, which is becoming a bigger and bigger field of interest for a lot of people, considering how expensive regular medications are. So this is what it would look like. This is another screenshot that I took on the drug levothyroxine. Let's go to that page for real. Let's go back to MedlinePlus. Here it is. So drugs and supplements is just underneath health topics, where the big pill is in the green space. So we're going to click on that. So if we wanted to look up, for instance, they do have categories over here already, but if we wanted to look up levothyroxine, which is what I just talked about in the screenshot, we go all the way down to L, and we find levothyroxine over here. And they do have the other names of it not just the generic names like levothyroid or Levoxyl. So if you don't know exactly that it's called levothyroxine, it will show up as that too. And up here is the most commonly asked questions that someone would ask about a medication like this, like why is this medication prescribed? What special dietary instructions should I follow? So if you want to go specifically to that question, you just click here, and it'll take you right down to that section. And like the regular search page in the health topic, it is very easy to read. It's clearly spaced out, and it's just very, very helpful, I think. Oh, here are the brand names like I talked about. Yep, so that's, oh, it even has a pronunciation. There's so many medications that I don't know how to pronounce off the top of my head, so that's very helpful. So forget an overdose, other uses for this medication is also helpful. This is stuff that if your doctor does not have, or healthcare provider does not have time to explain to you, this is a great resource for people. Or I've had some patrons be unsure of the effect that they would have on them. So they can actually print this kind of page out and go to their doctor during their visit and discuss based on what they find on here. So I like to tell patients before you go to your doctor's visit, you print out whatever information you can find so that you can have a healthy and honest discussion with your doctor in order to find the best treatment for you. And speaking of best treatment, if you want to talk to your doctor about exploring other complementary medicines in accompaniment with the prescription, here is where you would find the herbs and supplements section. And all of these pretty much go to the National Center for Complementary and Integrative Medicine, which is a really great site, by the way. But for instance, let's, everybody's talking about green tea, for instance, like what's so great about that? So let's go to green tea. So it'll take you to this page specifically just on green tea, its background, how much we know about it, what have we learned, and what studies have shown that it's help in terms of health. So it might be lacking, it might look like it doesn't have a lot of info on it, but all of this is basically just a summation of what has been found in studies that have been done, which are all down here in key references. So these are very good citations of the PubMed articles that have been published about green tea and its effect on, let's see, prevention of cancer, the primary prevention of cardiovascular disease. And for some people, you might not have access to these articles. I know, and this library actually has access to the articles. So if you are curious about being able to look up these articles and see for yourself what they say, just email me and I can try to get access for it and be able to email you the article. I'd be more than happy to do that. So that's basically how this website works. It's just a great resource for if you want to learn more about specific herbs and supplements. But of course, what's very important is to emphasize is that if your doctor tells you to take a medication, please take it. You should definitely not avoid taking medications as your healthcare provider tells you to, but if you do want to explore this, just let your healthcare provider or doctor know ahead of time. So we're going back to the home page and we're going back to here, where we will go to the third feature of this database, which is the videos and tools section. It's split up into health videos on topics such as anatomy, body systems, and medical procedures that I've been told that medical students also watch. It includes links to checking your health status with self-assessments and quizzes that are provided from various medical organizations. And you can also test your knowledge or learn with some educational, not educative, and interactive games. So that's just a video of one of the health videos that I talked about, which is the talking about heart bypass surgery. Don't worry, we're not going to watch that. And then we also have from the National Heart, Blood, and Lung Institute, a self-assessment of your BMI. I'll just show you quickly how that looks. So it used to be down here, the videos and tools section, but now it's actually up here, up at the tab. It's the very last tab. So if you go here to health videos, click here, and you can see they have all sorts of topics for health videos. You can learn about how Alzheimer's disease affects the brain.
A plaque is an abnormal cluster of protein fragments.
So very short. This one's only 35 seconds. And if you're not able to listen to it at full volume, you can also do the closed captioning. They have a reviewed, and that's what I should have pointed out in the other screenshots that I did, that every single page on this website always has a review date, as well as who updated it and what their credentials are. So that's one of the good qualities. That's how you know that that source is reliable, especially when it comes to health information, when they clearly state when it's reviewed and who, especially who reviewed it. Should have mentioned that earlier. They go from very specific things for Alzheimer's disease, from Parkinson's disease, to just the brain components of the brain, which that's some nice music. But yeah, so it goes from very specific to very general in terms of the health videos. So a lot of stuff you can look through. You can spend pretty much all day looking through these videos. And then we have the self-assessment tools, which are here. The one that I talked about in the screenshot is the body weight calculator, body mass index thing. And this is from the National Heart and Blood Institute. So they have their own BMI calculator. You put in your height and your weight, and they'd be able to compute the BMI for you, which is what your doctor would already want to do when you do it for your checkup. But if you already know ahead of time, that's great for the doctor to know. They have a lot of things ranging from diabetes testers, food portion, exercise, immunization, mental disorders, all the way down to weight loss and such. So a lot of great assessments here. And then the unfortunate thing is that when they updated this website, they actually got rid of a lot of the games that I liked on here. But as you can see, it's very, very small, their games currently. But I did like some of them. For instance, this drug use and effects. It does lead you to a really good site on drug abuse, the National Institute on Drug Abuse, Advancing Addiction Science. It'll be great to give to, anyone who's currently ignorant or unknowing of specific drug facts. This would be good for educational resource for if you have any children, or if you're an educator and want to teach a health class on this. So those are the type of games that are good. So that's just some of them. Oh, let me just point out to you that one of the biggest hurdles that a lot of people have to go through when they go to their healthcare provider, or just talking with any medical person, is just being able to understand the medical terminology. In the videos and tools section, they do have an understanding medical words tutorial, which is really cool. I went through this when I first started this job, and it's amazing how much of once you figure out what the different Latin roots of each terms are, of the anatomy of specific conditions, it's really easy to figure out what each word means. So it's basically like a free class. So I would really take advantage of this if it can make a big difference for you. And then they even have an evaluating health information tutorial, which is kind of what I'm doing right now. I'm providing you a source that is better than most sources that you'd find on a Google search page. So as you can see, you're able to compare and contrast different websites to see which one would be more reliable and accurate. So please check this out. It's a great source for being able to evaluate your own health information that you find online. So I think Yep, so we're on this section now, where I just wanted to go over the bottom part of the site, which is easy to read materials. We were talking about being able to print out handouts for easy access. So they have a lot, as you can see, they have a lot of topics that are available. They have a section to find a collection of organizations that provide health information. So every single health topic has links to different organizations. This is where you can just go directly to find the organization that you want. So if you want to look up Alzheimer's, you go to the Alzheimer's Association, and it takes you directly to it. They have a whole list here, as you can see. And then we have a directories page, which is very important because it'll help you be able to find specialists for a specific condition, because a lot of one of the biggest hassles for people can be just to find the right doctor or healthcare provider. I have a lot of patrons actually last year who had trouble finding credentials for their doctors because a lot of people base who they choose based on the doctor's credential and what insurance they carry. So one of the things I recommend people look up is DocInfo, which can verify a doctor's license and professional background. Just to give you an example, I did mention earlier that both of my parents are PAs, so we can actually use them for this example. My father's name is Leonid Belenkin. So you can see right here, his education, his active license in New York and Connecticut. So he's clearly verified. So that's good. And it shows you where they studied and what they studied, etc. So you can see all sorts of specialists and allergy immunologists, endocrinologists. And the best part is that not only does it link you to the specific ways to find the specialist, it links you to a really good organization's website. So not only can you look for things, you can also look up the information that the specialist would look you up about. So as you can see, they also have the hospitals and clinics, healthcare facilities, especially with the number of people, a number of seniors in this community. It is helpful to know where to find a nursing home, where to find a hospice or palliative care provider. So that's just this page, which is great. And for those of us who are bilingual or have relatives who speak a second language, you have health information in multiple languages. So for instance, if we go to Russian, it'll take you to all of the pages that they have that would be in Russian. So click on here, and it's a PDF. So it would have the English on one side and then the Russian on the other. So very printable, very easy to read, just great stuff. And then when it comes to health and nutrition, I really love what they did to update their healthy recipes section, because it didn't used to have its own box, but now it does. So here's the healthy recipes section. They got this different times of the day: breakfast, lunch, dinner, specifically drinks, specifically snacks, specifically dips, salsas, and sauces. Let's go to my favorite, which is dessert, of course. So they have a few options here, and when you click on one of them, oh, that looks really good. It has the nutritional information, the ingredients, prep time, and most importantly, the directions. Now, it doesn't look like they have a lot of options out there, and they don't necessarily make those options by dietary needs and such. So I would recommend going to the site that they get it from, which is foodhero.org, which gives you a lot more options in terms of the types of recipes that you want. So healthy recipes, 30 minutes or less, cooking for crowds, the specific ingredients, the cooking method, and especially for special diets, such as low sodium, vegetarian, dairy-free, etc. So that's where I would go in case you want to look for more options. But these give you this Medline Plus gives you a nice starting point and a lot of helpful information as well. So really great stuff. Health recipes. That's one of the things I always look at when I go on this site. Always want to get something new. I will be referring to this as a source when I do my I'm Not Stuffed webinar, which will be in November next month. Take a look at the classes and events calendar in Greenwich Hospital, and maybe you'll want to register for that. So we'll go back to here, and we have one more section that I wanted to go over, which is on education and advocacy. This ties in really well to next week's webinar that I'm doing, which is What Can I Ask, which is titled What Can I Ask? Your Role in Healthcare. Because it's, they're apparently, according to the National Health Institute, the average time that you have to talk with your healthcare provider is 15 minutes at most for a checkup, consultation, visit. There's so much that has to be said, especially when it's your first time meeting them. So you need to sort of advocate for yourself and be able to provide this information as well. It can't just all be on the doctor. So there are some helpful sources and sort of built questionnaires and tools that Medline Plus provides. For instance, you can fill out a question builder for your next appointment. That's what it looks like. I will show you what it looks like in a second. You can also fill out a family history, health history PDF, that's what it looks like. You can print those out and print out the results that they give into PDF formats and bring them to your next appointment and consultation, because it saves you a lot of time, you and your healthcare provider, and it decreases the risk of miscommunication, which is a huge outcome of not being prepared ahead of time. So I'll show you how to find the question builder and the family health history tool. But there are a ton of tools available on here that you can definitely look for on your own. So let's go to, where would it be? All right, it would be in videos and tools. Okay, so health check tools. It's where I talked about the assessments earlier. Okay, so I think it would be under H. Yeah. Yep. So the question builder for the health checkup. Question builder, be prepared for your next medical appointment. The organization is the Agency for Healthcare Research and Quality. So this is where you would put on your, this is a really great site, by the way, in case you haven't heard of it, the Agency for Healthcare Research and Quality. It always talks about like the patient side of everything, as opposed to just the healthcare, and how healthcare can make improvements to for patient advocacy. And this is one of them, the question builder, so that it'll ask you questions like choose what kind of appointment you need, and then based on that, for instance, if you want to just talk about a health problem, go to the next question. It'll go step by step on specifically what you want to ask. And then based on these results, it helps you just for yourself narrow down exactly what needs to be discussed at this appointment. And then we want to go to, right, the family health history. So that would probably be under F. It's not under F. Hold on 1 second. I thought it'd be under family health. Oh, no, that's the question builder. Sorry, I thought it would be under family for F for family. So let me just look this up. I think maybe the link is embedded in here. No, okay. Let's look for health history. Yeah, that's so odd. I thought it would be in here, but maybe they took it. There might have been another thing that they took down, which is really interesting because it's really helpful for you to fill out your family history ahead of time. I apologize, I didn't realize that they didn't have it up here. But this is essentially what it'll look like. I'll just blow it up for you here so you can take a better look. So it kind of reminds me of those charts that you would make for school where you outlined, your mother, father, and then you branch down to sibling, their sibling, cousin, whatever. So especially when you're meeting a new doctor for the first time, and you can request permission for them to view your health documents from your previous healthcare provider, but you can also just let them know, my mother has, there's a history of cancer on my mother's side, or there's a history of Alzheimer's on my father's side, and what your siblings share and what you might share amongst your siblings a risk of. So I really recommend finding this PDF in there. I don't know why it's not where I thought it was going to be, but this PDF, if you look it up on Google, it should show up. So that's what that looks like. Again, I apologize for having that. Another tool that you can definitely use, which I know is in MedlinePlus, is a medication list. So definitely put in the dosage, the type of medication that you take. Bringing a whole list of those to your doctor will really help with the prescribing side, and so your doctor knows what you're already taking, to make sure that whatever they do prescribe to you won't interact badly with whatever you're still taking. So this is actually the ending slide, but we do still have a bit of time. Let me look over what I didn't show you. Yep, so we actually do have a medical test feature on here. So for instance, there might be an issue of prostate cancer. You might be seeing signs and symptoms of prostate cancer, and you might be wondering, how exactly do they diagnose this? Your healthcare provider might tell you it's a PSA test. What is a PSA test? And you go into MedlinePlus, and here it is. They have information on specifically that, the prostate-specific antigen test. So it would say right here, all the information about why do I need it, what happens during it, what are the risks, and most importantly, what do the results mean. So it's just really good to have in terms of what you can interpret from the results and why you exactly need this, so that they're going to charge you for this. You might as well know what it is for. So, and then they just have in general how to understand your lab results in the related section. Oh, and they do have a survey, so that's always good. Yeah, so as you can see, they have a ton of tests on here. Yeah. And then they actually added a new section on here, which hasn't been here before, which is the genetics section. They're taking this from the genetics home reference database, which can help you figure out genetic conditions, just how genes work in general, and then just helping you to explore topics in human genetics. Because that's becoming a lot more important when it comes to research into long-term rare diseases such as Alzheimer's, cerebral palsy, all that. So, for instance, if we go here, we talk about the genetic testing that a doctor might want to give you to look at your conditions, mutations in health. If we click here, it'll take you exactly to like more and more details and topics. It's almost like much easier to read textbook, I guess, especially when it comes to genetics and you can't spend a ton of money on medical school. That's what I really like about MedlinePlus. I've always wanted to know more about health, but I didn't want to pay the money to become a medical professional. So I almost feel like this job allows me to do that, to learn more about health without having to go into debt doing it. So for anyone who's looking for information on genetics and just how to get tested, or if you have a history of a rare disease in your family, how do you learn about how the genetics would be passed down to future generations? This would be a great resource to know. I have yet to explore it because it's very new. It only just got started this year, so I will also be looking into it for sure. All right, so I guess the rest is up to you guys because basically the conclusion of this webinar is that MedlinePlus is free. It's very reliable. It is, as you saw in the website when I put it up on the screen share, it is free of advertising, any sort of bias or privacy concerns. It's very easy to navigate, in my opinion, and there are tons of tools in there for which you can educate and advocate for your own health needs. So thank you very much for attending. And I have my email and phone down at the bottom if you want to make an appointment with me. I'm available through Zoom, as well as, I know the visitor policy is kind of strict right now, but if you can make an appointment just to see me, but you have to do it in advance by calling or emailing me. So this is where I will take some questions. We actually ended a little bit earlier than I expected, so if anybody has any questions, please use the Q&A in your taskbar. I would love to hear from people. Let's see, we have 2 attendees, Florence and Jill. Hi. I hope this webinar was enlightening. I don't know if either of you guys knew about MedlinePlus before this presentation, but if you have any questions, please, this would be the time to do it. Seems like we don't really have any questions so far. So if there are no questions, I think that's where we'll end for tonight. But again, thank you so much for attending, Jill and Florence. And I do have more events coming up every Wednesday of this month, for the rest of this month, and for November and December. I mostly schedule it on Wednesdays. The next one is gonna be the What Can I Ask? My Role in Healthcare, where I'm gonna be talking about more in depth what you can bring to your doctor's appointment to help speed up the process and get down to business, have less risk of miscommunication, etc. I will be going into more depth in that in next week's webinar, and you can register for the same way that you register for this one, which is to go on the class and events page at greenwichhospital.org and just register ahead of time. I'd really love to see you guys again. So that's going to be at 4:30 to 5:30 again at this exact time. So hopefully that works for you. So with that being said, I think this is where we'll conclude. So have a good night, everybody, and hope to see you next week.